We look in depth to the symptoms of hypertension. Now, these symptoms of hypertension is more of like what the patient will tell you, what they will complain about, right? That's the symptoms of every disease condition. Symptoms of every disease condition is what the patient, when the patient comes to the clinic, what they are complaining about. All right. So for hypertension, we have already spoken about hypertension, where the resistance, the artery's resistance to the blood flow is very high. Okay, it's a condition where the artery resistance to blood flow is high. So let's get to look at the uh, possible symptoms that a patient with hypertension could have. Sometimes these patients could be asymptomatic. And when they say something is asymptomatic, they are simply saying, okay, this patient has the problem, but there is no obvious signs of it. That's when we term this disease condition as a silent killer. All right, because hypertension will be there and it will be eating up the body system very slowly without you even noticing. Okay, so sometimes they might complain about headaches, lightheadedness, palpitations. Palpitations is when your heart is beating and you are aware that your heart is beating, because normally you shouldn't be aware that your heart is beating. Okay, they'll be having poor sleep, that's insomnia. They're having problems sleeping. They're having chest pain. They'll be having shortness of breath, having some other complications, and a sudden death. Okay, so all of this could actually what comprise the symptoms of what hypertension. Right, so you can see this is hypertension. You can see atherosclerosis, deposition of fat in the arteries. So it will now narrow the pathway for blood. Okay, so thereby the arteries will now be resisting blood flow. Right, so that's it for the symptoms of hypertension.